Hello viewers, today I have some news for you, and it is not good news. In the spirit of breaking bad news, I'll deliver it in the spikes technique. So I hope you are comfortably seated and we will not be interrupted during this discussion. I assure you that my phone is silent while we are having this discussion, and if you want any family member to join us during this discussion, then please feel free to do so. Now, could you please tell me what is your existing opinion regarding MRCS ENT? So you might be someone who is a medical student and has watched my videos and considered MRCS ENT as a lucrative opportunity just after completing MBBS. You might be someone who is pursuing post-graduation in ENT and has considered MRCS ENT as a very attractive option, or you might be someone who has completed post-graduation in ENT and thinks MRCS ENT is a worthwhile endeavor. Now, based on your individual situations, the reality now looks starkly different because of the announcement that I'm going to talk about today. This announcement came out on 15th July 2024 and I was only made aware of it today. And so we'll just read the notice verbatim first, and then we'll try to unpack what it tries to say, and I'll give a little bit of my opinion also. So this notice has come out from the Intercollegiate Committee for Basic Surgical Examinations, basically the authority which conducts the Surgical Royal College's exams. So what does the notice say? Let's read it together. Cessation of the MRCS ENT examination. Following a stakeholder engagement process, ICBSE and the 4 surgical royal colleges of the UK and in Ireland are announcing that the MRCS ENT is being discontinued, subject to GMC approval. This will ensure that the summative assessment that candidates sit between the general phase of training, also known as core surgical training, and subsequent specialist phase of training, higher surgical training in the UK, is consistent between all the surgical specialties. The last diet of the MRCS ENT OSCE will be delivered in February 2026. Transition plan. ICBSE and the colleges are announcing the cessation of the examination at this stage to enable first-time candidates planning to sit the examination 5 further opportunities to do so. This represents 4 attempts in line with the examination's regulations, in addition to a further discretionary attempt in line with ICBSE's additional attempt policy. First-time candidates wishing to avail themselves of the maximum number of attempts at the MRCS ENT examination are therefore required to apply for the October 2024 sitting, the deadline for which is 15th August. Candidates applying for the examination after the October 2024 sitting will therefore not have maximum number of attempts available to them, but can still apply for the remaining sittings of the examination. Candidates who plan to enter ENT higher surgical training in the UK but have yet to attain the MRCS ENT by February 2026 will be required to pass the MRCS Part B in order to exit from core surgical training. Candidates in this position will have the full number of attempts to pass the MRCS Part B in line with the existing regulations, subject to the time limit identified within these. Any candidate planning to enter ENT higher surgical training in the UK may now choose to take the MRCS Part B rather than the MRCS ENT OSCE. So let's unpack this. First and foremost, for those who have just completed MBBS or who are pursuing MBBS and have considered MRCS ENT as a lucrative option, you can still take the MRCS exam, you can still pursue higher surgical training in ENT, but for you, instead of having to read a lot of ENT to prepare for MRCS ENT OSCE, you would have to read a lot of general surgery to prepare for MRCS Part B. If you are somebody who has just completed MBBS and you have not gone into post-graduation in ENT, then a lot has not changed for you. I presume it will be easier for you to read a lot of general surgery than to read a lot of in-depth ENT, because general surgery, let's face it, is taught in a much more in-depth manner, and we also read a lot of general surgery during MBBS compared to ENT, which is largely a neglected subject, relatively speaking. So if you are somebody who has just completed MBBS or are still pursuing MBBS, then your way of getting into surgical training in the UK is MRCS Part A, which is largely a general surgery exam, along with a little bit of basic sciences, that is anatomy, physiology, biochemistry, not biochemistry that much, anatomy, physiology, microbiology, little bit of management issues in the UK, legal issues in the UK, little bit of orthopedics, but mostly general surgery. And MRCS Part B also, I presume, will be predominantly general surgery syllabus. So not much has changed for the people who are thinking of MRCS after MBBS. Now, for those who are already pursuing post-graduation in ENT, and especially for those who have completed post-graduation in ENT, this news is a game changer. Because if you are someone who is thinking of MRCS after you have completed post-graduation in ENT, or after you've started post-graduation in ENT, it is already difficult for you to prepare for MRCS Part A, which, as I said, is a largely general surgery exam with a bit of basic sciences. You are completely in the ENT world because of your post-graduation. You have almost developed tunnel vision, especially if you have become an ENT specialist, to again go back to the world of anatomy, physiology, pathology, and general surgery, nitty-gritty of general surgery. It becomes a challenging task. So for people who are ENT specialists or who are pursuing post-graduation in ENT, you will have to read a lot of general surgery, not just for MRCS Part A, as was the case till now, but also for MRCS Part B, which will, in my opinion, not contain much ENT. It will be mostly a general surgery exam. Now the natural question is, why did this happen? So this has been a long time in the making. Hindsight is 2020. I know people who had appeared in an exam called DONS Part A and DONS Part B, or DONS Part 1 and DONS Part 2. DONS Part 1 was an MCQ exam. You can find videos on my channel where I have talked about how I answer questions regarding why did I not take DONS, why did I take MRCS Part A. Now, given a choice, I may have opted for DONS because I appeared in MRCS Part A after completing post-graduation in ENT. So I don't want to discourage anyone. You can, if I could pass MRCS Part A after completing post-graduation in ENT, you can pass both MRCS Part A and MRCS Part B after completing post-graduation in ENT. Just that I may not be able to help you with MRCS Part B because I don't have any experience of passing that exam. Now, as I was saying, there was an exam called DONS Part 1, which was a multiple choice question exam based entirely on ENT syllabus. This exam did not exist when I started applying for the Royal College membership exams. Okay, so this exam was there. Some people who I know had appeared in the exam, passed the exam, but it stopped existing when I started applying for it. So for me, the path was quite simple: MRCS Part A and then MRCS ENT OSCE. So the Royal College of Surgeons, in their wisdom, removed DONS Part 1, which was a multiple choice question based on ENT syllabus. They kept the OSCE pattern ENT exam, which was DONS Part 2 or DONS OSCE. They changed the name to MRCS ENT OSCE. Now they have decided to remove the MRCS ENT OSCE pattern exam also. So now if you want to enter higher surgical training in the UK, you have to complete you have to do well in a multiple choice question exam, which is general surgery predominantly, and then an OSCE pattern exam, which is also general surgery predominantly. I'm presuming there will be a little bit of other subjects also, but predominantly it will be general surgery. Why did they do this? I believe they did this because the surgical training pathway in the UK follows a system where you have to do 2 years of foundation training after completing medical school, and then 2 years of core surgical training. the phase that is used here, general phase of training or core surgical training. This is mandatory for everyone who is pursuing medical education in the UK. At the end of these 2 years of core surgical training, people in the UK, doctors in the UK, get the opportunity to appear in MRCS exam. Now, many people would not have extensive ENT experience, as opposed to someone like me who had 3 years of ENT experience in India, at least 3 years of ENT experience in India during post-graduation, and subsequently I also had ENT work experience. So I was firmly in the ENT world. So MRCS ENT OSCE perhaps was easier for me to pass compared to the native UK doctors who would have been appearing in MRCS ENT OSCE with much less ENT experience than someone like me who had trained in ENT overseas. The other thing that I feel, and again this is opinion, I do not have access to anyone who is in a position of making any decisions in the UK, so this is pure speculation and pure opinion. The other thing I feel is the authorities in the UK as well as countries like the US feel that ENT is a subject that one should only specialize in after they have acquired basic surgical skills, or they have, as is said in the UK, core surgical training. So many people have asked me, do you require experience, clinical experience in surgery to appear in MRCS? No. But no, only if you are not from the UK. If you are from the UK, then not only do you require a primary medical degree, you also need to have completed 2 years of core surgical training. Again, I don't know if it's 2 years, but definitely you need to get into core surgical training. Mostly it will be 2 years. But if you are from outside the UK, if you have completed MBBS, that's the only eligibility criteria. As long as you have a primary medical degree from a medical college which is part of World Directory of Medical Schools, you are eligible to appear in MRCS Part A. Once you pass MRCS Part A, you can appear in MRCS ENT OSCE. That's how it is. You don't need any clinical surgical training experience if you are not from the UK. But if you are from the UK, you require those 2 years of surgical training. So maybe they feel that UK doctors are undergoing these 2 years of surgical training, so it is only fair to have the entry exam to surgical training consistent with the training that UK doctors are receiving, which is predominantly general surgery, I presume. So MRCS Part A syllabus will be largely similar with MRCS Part B syllabus. And if you wish to pursue higher surgical training in the UK after completing post-graduation in ENT, or you want to work as an ENT specialist in the UK and you need the Royal College membership pathway to get the GMC registration, then you would have to read a lot of general surgery, both for MRCS Part A and for MRCS Part B. Now this is not impossible. Even if you have completed post-graduation in ENT and you have been largely removed from the world of general surgery for many years, it is still possible, because it happened with me. When I passed MRCS Part A, I knew many of my peers who were surprised, to put it mildly. They had asked me, how did you read so much of general surgery 3 years after completing post-graduation in ENT? Which basically means 6 years after seriously reading general surgery. So I had read general surgery seriously in perhaps winter of 2015, and I appeared in MRCS Part A, which I'll remind you is largely general surgery, in September of 2022. So that's a gap of almost 7 years. So if I could do it for a multiple choice question based exam, you can also do it for an OSCE pattern exam. And I'm sure there will be many resources available to you. So that's my thought on this. So what I feel is, in the UK and in the US, ENT training is considered as something which people should only get after they have undergone some form of general surgery training, which is consistent to the way things are conducted both in the UK and in the US. Even in the US, where a typical ENT residency is of 5 years duration, there is mandatory time allocated to general surgery training. And as I said, in the UK, there are 2 years allocated to core surgical training. In fact, I know a person who only had 4 weeks of ENT experience and was able to comfortably pass MRCS ENT OSCE. I had the opportunity to practice while I was preparing for MRCS ENT OSCE, and we used to have conversations where I was told that I have so much more experience than this person, but so maybe those were factors. So this must have been discussed in great detail with all the stakeholders. They are saying there was a stakeholder engagement process, and they decided in all their wisdom that MRCS ENT OSCE will be discontinued from February 2026 onwards. Now, if you are someone who has already passed MRCS Part A and is from the ENT background, or wants to pass MRCS ENT OSCE instead of reading so much general surgery for MRCS Part B, then my request to you will be, don't waste time. Book the MRCS ENT OSCE as soon as possible. So the rules are, you get 6 attempts to pass MRCS Part A and you get 4 attempts to pass the OSCE pattern exam. And you have to pass the OSCE pattern exam within 7 years of passing MRCS Part A. Now, if you have passed MRCS Part A, you require about 6 months of preparation time to pass MRCS Part A. Speaking conservatively, you can do it in less time if you are not working. If you don't have a busy schedule, then maybe you can prepare for MRCS Part A in a shorter interval of time, but I believe 6 months is required to prepare in a proper way for MRCS Part A. If you have already passed MRCS Part A, please book MRCS ENT OSCE as soon as possible, because it will be delivered for the last time in February 2026. MRCS ENT OSCE was held thrice a year, so the next exam will be in October of 2024, and then there will be 3 exams in 2025, one in February, one in May, and one in October, and then one more exam in February 2026. So effectively there will be 5 more exams of MRCS ENT OSCE. So I guess after February 2026 nobody will have MRCS ENT as their diploma, as I have, because I passed MRCS ENT OSCE in May 2023. And I wish all the aspirants best of luck. Change is perhaps the only constant, and I'll keep you posted if I get any more updates on this issue. Thank you for watching this video. Take care. Bye bye. And please, if you have any questions, reach out to me. I'll be happy to answer your questions. I reply to every comment that I come across on this channel. Bye bye. Take care. And please don't forget to be awesome.